Epidemiology, the Sherlock of diseases. Descriptive epidemiology. How do health organizations decide what healthy eating recommendations to make, like having a balanced diet and cutting down on sugar? How did they prove that smoking can lead to lung cancer? These are some examples of public health decisions based on epidemiology, the science of understanding how what we do may affect our overall health. The word epidemiology comes from three Greek words: epi, demos, and logos, meaning upon, people, and study. As an epidemiologist, I study the spread and control of diseases. The aim is to describe the distribution and size of diseases, to identify the factors causing the pathogenesis of the diseases, to provide the data gained to plan and implement services for the prevention, control, and treatment of the disease. The definition helps me understand how the disease is distributed. What are the surrounding factors causing the disease? Who is the targeted population that is at risk of developing the disease? And what steps should be taken to treat the disease? Now let us understand how epidemiology is classified. The two studies that come under it are observational and experimental. Observational studies are further divided into descriptive and analytical epidemiology. A descriptive study is one where a hypothesis is formulated, and an analytical study is where this hypothesis is tested. Experimental studies are ones where the formulated and tested hypotheses are confirmed. To understand this classification, let's take the example of an obese person working out at the gym. As an epidemiologist, my observational study would involve just observing the person without any intervention. In this example, descriptive epidemiology would involve formulating a diet plan. Testing this diet plan is done using analytical epidemiology. On the other hand, experimental studies involve observation along with intervention or manipulation. In the above example of the obese man in the gym, I suggest a specific diet or exercise regime that suits him. This will confirm whether the diet plan works or not. Did you know? The history of epidemiology dates back to Hippocrates, around 400 BC. Epidemiology first appeared in the Spanish book Epidemiologia Esponi by a Spanish physician, Joaquin de Villalba. Now let us come back to the details of descriptive epidemiology. In this type of epidemiology, I ask the question who, where, and when. If I want to check the pattern of a disease, such as oral cancer, I use a 6-step approach. First, I define the population that has to be studied. For this, I take the entire population or a subset of the population that does not migrate but remains stable in the area. Second, I define the disease under study and then measure it with a degree of accuracy. My third step is to describe the disease in terms of time, person, and place. First, let us discuss how to describe the disease by time. These can be short-term fluctuations or long-term fluctuations. If the disease occurs in a short period, such as food poisoning, they are called short-term fluctuations. These can be further divided into periodic fluctuations, seasonal variations, and cyclic trends. If the disease occurs periodically, they are called periodic fluctuations. Seasonal variations include diseases occurring in a particular season, for example, common cold in the winter and heat strokes in the summer. Cyclical trends include diseases that occur at periodic intervals. For example, road traffic accidents every weekend due to increased trips. Now let us move on to long-term fluctuations. Long-term fluctuations are also known as secular trends. Here, the disease takes a long time to develop. For example, oral cancer can take up to 6 to 7 years to develop. First, let us discuss how to describe the disease by place. The diseases under study can be within international or national borders. Lastly, let us talk about describing the disease by person. Here, I study a disease specific to a particular age or particular sex. For example, periodontitis and lichen planus are more common in females, and oral cancer occurs more in males. This study also includes the diseases specific to a particular race. For example, Burkitt lymphomas can be observed more in the African race. Once I have described the disease in terms of time, place, and person, I move on to my fourth step, which is the measurement of the disease. This step is helpful to measure the severity of the disease and check the disease load in terms of mortality and morbidity. Mortality is the total number of deaths and is expressed as the death rate. Morbidity is the total number of people affected. Morbidity refers to the presence of disease, illness, or injury within a population. Now let us understand the process of measurement of disease. The number of new cases is called incidence, and the total number of new and old cases is called prevalence. Diseases can be measured using two designs, cross-sectional and longitudinal. Cross-sectional designs mean the disease occurs at one particular point in time. For example, a short survey taken on oral health. Longitudinal designs measure the disease over a period of time. For example, surveys on oral cancers can last up to 10 years.
Pop quiz.
Now let's move on to the fifth step, which is a comparison with known indices. This gives me a clue as to what is causing the disease and helps me identify high-risk individuals. My last or sixth step is formulating my hypothesis. Based on all my findings, I formulate my hypothesis, which can either be accepted or rejected. Now let us understand how I formulate my hypothesis. I set my target population with certain characteristics. I look for the specific cause of the disease. I define my outcome as the disease. I calculate the amount of load needed to cause the disease. And I calculate the total time needed for the disease to occur. When all these steps are done, I formulate my hypotheses. One such example is the smoking of 20 cigarettes per day for 20 years, which leads to oral cancer in 10% of smokers. Now, what are the benefits of descriptive epidemiology? It provides data for disease types and their magnitude, provides information on the etiology of the disease, helps in planning and organizing services and further research, We have now come to the end of this video where I explained all the details of formulating my hypothesis in a process called descriptive epidemiology. The next step is to test my hypothesis using analytical epidemiology. This will be discussed in our next video. We hope you had fun learning with us.